Thank you. Well, if you're having trouble reading menus and you feel like your eyes are just getting old, well, don't worry. Dr. Heaton Lakhani is here with a solution to, let me see if I can get this right, presbyopia? Presbyopia.
Yes.
Or, you know, I've practiced that 22 times. Or what he calls old eyes.
Correct.
Old eyes. Can we just say that instead of
We can say old eyes. That's right. That's right. That's really what the terminology means in Greek terminology.
What is it?
Well, presbyopia, pretty much anyone above the age of 40, unfortunately, somewhere in the 10 years from 40 to 50, will start having difficulty reading up close. So you'll see people complain that I have to hold my menus out further than usual, or things that I used to see before with glasses on, I can't see anymore. And what really happens is that there's an internal clock in your eye, or an internal lens, that ages. Just like a tree ages with time, the lens starts getting thicker with time, and it loses its flexibility. So all along, as you're younger, the lens is flexible, so it allows you to see distance and near because of its flexibility. As it gets older, it becomes thicker, more rigid, and less flexible, and so you start losing the reading ability.
Is this a disease?
No, it's not a disease. It's a condition, an aging condition of the eye, basically. One of the very, very few aging conditions of the eye.
It just means you're getting old.
It means you're getting old. But, it's different from everybody. That's right. The range is from 40 to 55. So you can have someone who's 47, not be old, and not having any reading glasses, and then have a different story with someone who's 40.
Can you cause it? Because you can. Research shows that you can age your body by being stressed out too much.
Correct.
Can you cause it to accelerate by aging your body by being too stressed?
No, not at all. You can't cause it by reading too much. You can't cause it by really any diet or anything like that. It's more of a genetic thing and an age thing. And you'll find that there are families that have people that are much older and have no reading glasses. So I think it's a genetic predisposition as well.
Okay, so I was thinking that the folks that they in the profession of like computers, where they're sitting at the computer and they're reading print all the time, or versus a person who has a profession where maybe they're traveling the world on a sailboat, they're travel writer, whatever, so one of them is not more likely to get it.
Not from what the studies have shown,
really?
But we do know that when you start having that process of figuring out that you're having reading difficulties, they tell folks not to try and jump into reading glasses right away.
Ooh.
Struggle with it as much as you can until you start getting the headaches and the fatigue and the tiredness after a long day and the struggles. Then start using the lowest power that you can out there, over-the-counter readers.
Once it starts to actually affect your quality of life, then go ahead and go with the reading glasses. We have a picture that we wanted to show.
Right. And this is a picture of the lens that's in the eye, and the lens shows the two different sizes. One is thick, one is thin, showing what happens with accommodation with a normal young lens.
Well, this is a good picture to have up for my next question. I was going to ask you, I read somewhere about being in brighter light actually makes it seem less severe.
It does, mostly because you have more lighting to help you with the reading. But your needs are still there. It's just the brighter light helps you see things around letters better, so you can clarify between the letters much better. And that's with also nighttime driving, things like that.
Oh, nighttime driving. Oh, that's a different story. So can you cure it? Is there a cure?
Well, there is no cure right now for that because it's an internal aging process, but we do have ways to have people get around it by LASIK surgery and some other forms of surgery.
And you do the LASIK?
We do the LASIK. And then what we do with the LASIK is we kind of trick the eye. What basically happens is your eye doesn't have the ability of doing distance and near anymore. So we use one eye for the distance, and that's your dominant eye, and the other eye for the near, and that's called monovision.
You're kidding me.
No,
seriously?
no,
you fix one eye so that it can...
Correct.
So if I'm trying to see from at a distance, I'm looking at...
Well, for the people that it works beautifully on, and that's true, there are people that the eye and the brain just won't connect. But for those that it works great on, they won't even tell. So when they have both eyes open...
It's like this.
That's correct.
Yeah.
That's correct. They won't know that one eye is doing the distance and one eye is doing the near, and together the balance is great. So those folks love it because they can see distance, they can see near, they can drive a car and pick up a reading material anytime they want, and they don't feel any issues at all. And there are thousands of people that we've done that love it. Now what we do though is we first test it. We have to make sure your brain can handle it, so we do contact lens trials to make sure that it is something that would work for them.
Oh, really?
Yeah.
Okay, so there are certain types of people that it won't work on.
Correct. And through an examination, you will know if the brain can handle it. Now there's some people right off the bat, we know they can deal with it. Others, it may take a month to 3 months to really try with the contact lens, and it will simulate what it's like with the LASIK surgery.
How cool.
And then the brain just, for those people, tends to connect and does very, very well.
How cool.
So it's a new thing for people who feel like they can't do anything about their reading glasses.
But you do such extreme stuff like that? Well, not really extreme. I mean, that's mainstream these days, really, for highly educated people like yourself. But you also do just the basic eye exam too, do you not?
Correct.
You just,
Correct.
I mean, because I was teasing you about how, you know, my 32-year stint with Perfect Vision has, I think, come to an end.
Correct.
But guess what? I went into the drugstore and went on the little reading glasses thing and gave myself a little eye exam, and I was just fine. But turns out, I don't think that's reliable.
Well,
I think I need to come see you.
Well, you can
Don't
definitely
laugh
come
in my
and see
face.
us, and then we can talk about that. But you are still young for reading. 32 is a young age.
Okay.
Normally it's 38 plus, 38 to 40 plus.
It's a young age, he says. Dr. Lakhani, thank you so much
You're
for
welcome.
being in
It's good
here.
to be here again.
Hey, it's
Thank
a
you.
pleasure having you. It's a pleasure having you.